Okay, so now we will discuss our range of motion. Okay, range of motion. First and foremost is our flexion and extension. Flexion is the bending movement that decreases an angle of the joint to bring the articulating bones together. Okay? Bending movement. Wait, sa ala. Ano ba ni? Uy. Gusto. Dira. Whereas extension is the straightening movement that increases the angle. So pareha ni class. When we say flexion man good, when the muscles flex, okay? When it contracts, okay? It bends, di ba? Mura siya bend. Therefore, the angle is decreased. Okay? Muna siya ang flexion. Whereas, when we extend or when we straighten that arm, the angle is increased. The size, or the degree of the angle is much larger compared to during flexion. So that is our first range of motion. This is commonly seen in our what we call this, our arms. Napuli sa tong legs, okay? Next is abduction and adduction. Abduction is the movement away from the medial or mid-sagittal plane. Okay, when we say median plane, this is the center. Okay, away from the center. Whereas adduction is the movement toward or padulong sa medial plane or sa median plane. Now, ingani na siya class. For example, the median plane is this one here, drawn in red. Okay? In abduction, di ba, niingon to siya away from the median plane. Okay? Meaning to say, if our arm started here, when we abduct it, we will move it away from the body. Di ba? So, mo na siyang it extends towards the lateral portion of the body. That is abduction. Whereas, in adduction, if it starts at a lateral position, we can adduct it by moving it towards the center. Ayan. Okay, next is pronation and supination. Pronation and supination is refer to the unique rotation of the forearm, just like this. It is best demonstrated with the elbow flexed at a 90-degree angle. So kana like this, okay, with the thumb facing up. Now, when you pronate it, you will turn your forearm 90 degrees. Okay, wherein now in pronation the palms face downward. Okay? That is for pronation. Whereas when we rotate it the other way, 90 degrees gihapon, that is now supination, wherein the palms face upward. Okay? That is the difference between pronation and supination. Next is eversion and inversion. Eversion is turning the foot so that the plantar surface or the bottom of the foot faces laterally or towards the outside. Okay? Whereas inversion is turning the foot so that the plantar surface faces medially or towards the inside. Now, yan na siya class. Okay, mo ni siya ang atong center line ha. This is the inside kini. When we say inversion, as you can see, the bottom portion of the feet, it faces towards the middle. While in eversion, away, di ba? Away or lateral, it faces outside or going towards the outside of the line, di ba? That is inversion and eversion. We also have what we call dorsiflexion and plantar flexion, also seen in the foot. In plantar flexion, it is the back of the foot is flexed, The back of the ankle is flexed so that the tips of the foot face outwards. Okay, or towards downwards, faces downwards. Whereas in dorsiflexion, the front part of the foot, or the ankle, is the one that contracts. Okay? Meaning to say, when it contracts, the tips of the foot face upwards. Okay? Upwards. So that is the, that is the difference. Next is rotation. Rotation is turning of a structure around its long axis, as in shaking. No. Rotation of the arm can be best demonstrated with the elbow flexed. Okay, so kini siya class, no? Rotation. If this is my arm, okay, this is my arm and I rotate it towards the body we call that medial rotation. Okay? But if we rotate it away from the body, no? Away from the body, we call that lateral rotation. Kung pagawas. Okay? If you rotate it going outwards, that is rotation. Okay? Next is circumduction. It occurs at the freely movable joints such as the shoulders. In circumduction, the arm moves so that it traces a cone where the shoulder joint is at the cone's apex. So, this is muna siyang circumduction. If this is the apex of the shoulder, or this is the shoulder joint, this is the apex, no? It creates a sort of cone. Yang imong movement anak class, your movement around that is circular. Circular, so bali murag is like you're twisting, not twisting, you're rotating your entire arm around the shoulder joint. That is circumduction, no? You are rotating your entire arm around the circle joint. So that is circumduction. Now next, no, we also have the types of joints, no? And now for the types of joints class, we have 3 types, no, but we will be mainly focusing on synovial joints. Okay. Now, fibrous joints are connected by fibrous tissue. Okay? Wrong. Connected by fibrous connective tissue. Ayan. Okay? And mostly, no, they are non-movable. An example of a fibrous joint is katong ato ang mga suture. Yeah, suture. Suture katong sa atong skull, no? During the time when we grow up na and it merges or it fuses together. Kada mga fibrous joints na sila. Okay? We also have what we call our cartilaginous joints. As the name of it as it implies, no, it is connected by cartilage. Connected by cartilage. Okay? But we will be mostly focusing on our synovial joints. Okay? Now, ingani na siya ha, synovial joints. There are a few a synovial joint. It contains a space between the bones that is filled with synovial fluid. Okay. Now, what is synovial fluid? Synovial fluid class has one main function. Okay? Usara iyang main function. It has other functions, but ang iyang primary main function is that it reduces friction. Okay? Now, sa may naong sir, it looks like this. Okay? Assume that this is your humerus. Okay? Muna siya ha. Humerus. Ayan. Okay, it's not a penis. Okay. And this one here is your radius. Diba? Radius. This one here is your ulna. Let's say kana. Now, surrounding those two bones, diba? Do joint man sila. This is a type of joint, no? Synovial joint. Surrounding those two bones is a capsule filled with synovial fluid. Now, as the muscle contracts, diba? Muna siya atong muscle, atong biceps, no? Muna siyang iyang origin, and then muna siyang iyang attachment which attaches to the ulnar attachment. When this muscle contracts, okay, obviously ang bones nimo, it will touch each other, diba? And when it touches each other, class, it will create friction. Now, ang problema na class is this, okay? If there is no synovial fluid, if walay synovial fluid, friction causes pain. Friction causes pain. So it's very important nga na ay synovial fluid. Okay? So mo na siya ang basics of our synovial joint, no? Na siya ay capsule or a space that has synovial fluid. Now, here are the types of synovial fluid from 1 to 6, no? Ako giko, no, I have decided, no, that instead of discussing this, this was discussed in anatomy before. Instead, I will just send you the slides. Kaya ang tendency man good is what will happen is I will just be reading this in more na siya. I will show you the picture. So to save us both time, ako na lang isa na slides niyo because most of them man good, it's very self-explanatory na. No need to stago na kanang over magsigit ang storya ba, no? So imo lang siya basahon, it's very easy to understand. Okay, so diretso na ta sa ato ang subjective data. Okay, ako lang na-send ninyo. Okay, ayan. First is our present health concern. Okay, now first is we have to ask the patient about weight gain. Nga naman, if there is an increase in weight, it can result, pamina mo ha, listen. It can result in increased physical stress. Obviously, when you are heavier, no? When you are heavier, it will be more stressful, especially around your joints. Okay? And increase strain. Diba? Dili strain na ka ng muscle strain. Strain as in use, no? Increase strain. So we have to ask them, especially weight gain that is very sudden. Okay, very sudden ka ng pas good. Okay? Ayan. Ask the patient, no, if they have difficulty chewing. Because difficulties chewing, it might feel as if there is locking or a stuck jaw. This is a common sign of TMJ dysfunction. Wala. Temporomandibular joint dysfunction, di ba? Temporomandibular joint, wala. Wait sa. Yan. Jeez. And also we have to ask them about joint, muscle, or bone pain. Now, ang nakaapa na ni class, no, is that each of these types of pain have different characteristics, but the same goes, magamit gamit we will still keep using our cold spa. Now, for example, class, bone pain, no? Bone pain, pamina mo ha? It is usually often dull, deep, and throbbing. Okay, dull, deep, and throbbing. Whereas our joint pain, pamina mo ha? Joint or muscle pain, joint and muscle pain. Oftentimes, these are aching. Ngul-ngul. Okay? Aching. But it becomes severe with movement. Okay, it becomes severe with movement. If you keep moving, joint and muscle pain, magtalisakit na siya, no? It becomes much worse. Okay? And lastly, no, we also have what we call our fractures, no? For our fractures, no, it is oftentimes, ang characteristics sa fracture pain is it is sharp, knife-like pain. Sharp knife-like pain that increases severity with motion. Mo na siya, no? So that is for our present health concern. Okay. Next is for our past health concern. No, we have to ask the patient about past problems or injury, no? We this is to establish, no? Establish as always, di ba? Baseline data. Baseline data. Included in this baseline data is our current range of motion. Which limbs or which muscle or which joints can we move, di ba? Current range of motion. Aside from that, it establishes our level of functioning. Functioning. And lastly, no, since it establishes baseline data, it gives us a history, HXA history of injury. History of injury. And kini very important, no? Very important since this is musculoskeletal. Okay? Since this is musculoskeletal, take note, ha? Ato ni reason, ha? Take note of recurrent fractures. Recurrent fractures. Kanang fractures na magbalik-balik. Okay? Recurrent fractures. Why? Because recurrent fractures is a sign of possible physical abuse. Okay? Recurrent fractures. So, dapat imo na siya i-take note in your history taking. No? And for past health history, no, for a middle-aged woman, you have to ask them if they are already on menopause, no? Menopause, or if they are undergoing estrogen replacement therapy. Nga naman, because they are at risk, pumina mo ha, they are at risk, increased risk for development of osteoporosis. Nga naman, this is because they have decreased estrogen. Take note of that. Okay? Decreased estrogen. If decreased mo gud ang imong estrogen, if you have decreased estrogen, it will also decrease the density of bone. Okay? And what causes decreased estrogen is mostly menopause. Diba? Menopause. Maka-cause na siya og decreased estrogen. Next is lifestyle. No? Lifestyle. You have to ask the patient about their exercise, diet, or weight reduction habits. Nga naman, this is to establish, no? Establish patient's health competence. Okay? Health competence. Meaning to say, are they actively trying to promote or passively, what we call this, passively, ilan lang ipasagdan ba? Or what we call this, kanang promote or inhibit, no? Inhibit health, diba? Of the musculoskeletal system. Diba? Establish their competence. So, kung matubag sila, yes sir, I exercise that. At least you know na they are actively trying to promote their musculoskeletal system. Okay. Describe diet. No, you have to ask them to describe diet. Specifically, ask them if they consume milk. Why milk? Because milk has a lot of calcium. Aside from that, no, you also have to take note of protein. Dapat class, ha, pamina mo ha. You should ask them about their protein intake. Why? Because protein promotes muscle tone, bone growth, and recovery. Okay? It promotes that. Okay? Aside from that, we also have to ask them about vitamin C. Okay, next semester, magkuha naman mo, no, mag-nutrition and dietetics ka na. Very good. Good luck. Okay? Vitamin C promotes, okay, healing of tissues and bones. Promotes the healing of tissues and bones. Whereas, no, question man tag milk, no? If there is a decrease in calcium, pamina mo, if there is a decrease in calcium intake, it puts the patient at risk. Okay, increases risk for osteoporosis. Okay? If decrease gani ang ilang calcium intake, like for example, di sila mo inom og milk, it increases the risk for osteoporosis. And lastly, no, for this, di mo last, for occupation, no, ask them unsa ilang trabaho. Okay, ask them about their occupation. Why? Some occupations, no? Some occupations are kuan kanang nasa sila mga job-related activities. Job-related activities. Hala. Like, for example, kanang carrying. Mag-alasa mo. Carrying. Like, for example, ang imong trabaho kay porter. Okay? Aside from that, there is also possibly sitting around, di ba? Sitting around. Like for example, ang imong trabaho, your job is an office job. Okay? Nga naman. Why? Always consider two factors. Okay? If incorrect gani ilang body mechanics, especially when you are carrying heavy stuff, okay? If nagani sila poor lifting technique, okay? Poor lifting technique. And lastly, if nasa sila poor posture, especially when they are sitting around for long periods of time, okay? It can lead to possible back problems. Okay? It can lead to back problems. Aside from that, no, naman po tayo lain job-related activity. Another is typing. Grabe ito mag-type sa computer, typing or writing. Mina mo ni. Typing or writing. Okay? Kini man siya class, it has repetitive hand movements. And because na siya repetitive hand movements, it increases the risk for carpal tunnel syndrome. Okay? Carpal tunnel syndrome. Sige, go. Okay. And lastly, no, we have to ask them about their routine exercise. Okay? Nga naman, exercise. Number 1, it promotes, paminaw mo ha, promotes flexibility. And if you are flexible, no, you have a tendency to avoid injuries. Diba? Avoid injuries. Aside from that, it promotes bone density increase, no? It also promotes muscle tone, and muscle strength. Ayan. We have to ask them about this, you know? Now, why do we have to ask them about this? Because if they do not exercise, okay, if the patient, okay, the patient does not exercise, it could lead to degeneration of their muscles, otherwise known as your atrophy or hypertrophy. Diba? Mugamay na siya. Okay? Mugamay na siya, no? This is commonly seen in patients who are aging, kanang matiguang na sila, di ba? Normally, pag abot nimo mga around 50, 60, mo decrease na imong activity level, mo decrease na ang imuhang exercise. And as a consequence of that decrease in activity, mo decrease pod ang size imong muscles or mo degenerate ang imong muscles, di ba? And lastly, you have to ask them about their posture at work and at leisure. What type of shoes do they usually wear? Kay this is very common, no? The use of high-heeled shoes, okay, can cause what we call contracture of the Achilles tendon. Contracture of the Achilles tendon. Okay, ato suwat dito be. If namangod ka, if you constantly wear high-heeled shoes, okay, it could put you at risk for contracture of the Achilles tendon. Achilles tendon. No? We've already talked about posture at work before, and the same goes with leisure. No, if you have bad posture at work, it could have long-term effects, especially specifically pasin magka-back pain ka. Aside from that, there could also be shoulder pain, no? Shoulder pain, but mo na siya, no, those are the type of subjective data assessment that we have to ask. I just want to reiterate once again that you have to focus on mainly among which kining present health concerns. Okay, mo gyud silang main problem. However, as we will discuss in our actual lecture, no, face-to-face lecture, it's much better to assess this musculoskeletal on-site with a patient good. Okay, because much better if you can actually assess the physical aspect of the patient rather than interviewing them lang. Sige. And with that,